Hello and welcome to Introduction to Tourette Syndrome. My name is Betty Rennick. I'm the Assistant Director in the Southern California region.
My name is Wendy Wegman, and I am the Program Lead for Youth, Young Adult, and School Education.
So the prevalence of Tourette syndrome, and these are statistics for children from the CDC. 1 out of every 160 children between the ages of 5 and 17 in the United States has Tourette syndrome. 1 of 50 children between the ages of 5 and 14 have Tourette syndrome or another persistent tic disorder. Now, the difference between Tourette syndrome and persistent tic disorders is with Tourette syndrome, it usually involves a combination of motor and vocal tics, whereas with a persistent tic disorder, it usually involves either a motor or vocal tics, so one or the other. An estimated 50% go undiagnosed.
So Tourette syndrome is neurodevelopmental. That means that it affects how the brain functions. The center of the brain, the basal ganglia, is the part of the brain that chooses which action to perform at any given moment. In patients with Tourette syndrome, this is the part of the brain that is seen to be different. Symptoms of Tourette typically emerge between the ages of 5 and 7. They increase in severity and frequency between the ages of 8 and 12 years old. Tourette impacts males more than females, about 3 to 1. Numerous studies have confirmed that genetics are involved when people are diagnosed with Tourette syndrome. Tourette affects all races, ethnicities, genders, and ages. It is a lifelong condition, and right now there is no cure for Tourette syndrome. What is Tourette syndrome? We have a video to show you
to see who
that explains Tourette syndrome from the point of view of people that have Tourette.
Tourette syndrome is a medical condition that people live with in their daily lives. They make involuntary sounds known as tics. It could be a sound or a movement that the body cannot control.
I have this one. Sometimes I click my tongue in the back of my throat like this, but not very often, and I constantly crack my knuckles, even if I already did.
So they mostly would ask me like why my eyes keep twitching, or asking me if if I can stop moving my leg.
The tics were more like the head shaking as well, barking. I had a tic for a while where I'd step backwards and walk backwards for a couple of steps and then walk back. I had a tic once when I'd be standing and I'd lift up my leg.
When I was first diagnosed, I was out of school for weeks. My tics were very high. My vocal tics were elevated. My motor tics would really hurt me. It was tough.
7 or so years old, I was responding, well, is this just gonna keep on? When I was younger, they singled me out and treated me more as, as basically almost as if I was an alien in a sense. And because at that point in time, I didn't really understand much about what was happening.
Yeah, I have a 7-year-old. When I take him to school and I go down the elevator, right before we get on the elevator, I'll take my teeth and I'll bang my teeth against the wall. And he asked me, "What are you doing, Dad?" So I said, "Oh, I have Tourette syndrome. It's a condition that causes me to do things I don't want to do." And so the funny thing is, the other day he comes up to me, we're standing there and I don't do it on the elevator. And he says, "Daddy, you didn't do your Tourette's." And I'm like, no, it's not like that. It doesn't work that way.
It's hard to suppress a tic, and even if you do suppress a tic, when you're done suppressing the tic, they only come out more.
I have to morph my words. Instead of saying bomb, 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 I go ba or abba.
If I try to suppress them, it doesn't work. That's like trying to hold in a sneeze.
Young girls would laugh. Kind of embarrassing for an adult to be bullied by young teenagers.
As a young kid, I would tic whatever it was and immediately look around to see who noticed, like as if it really mattered.
And then you really start to believe that you are different.
I would be out on the subway and attracting attention from other people, adults, and like learning about how cruel people can be. Seeing those kids in DC at the conference, treating their tics as something to see who
So tics are involuntary repetitive movements and vocalizations. They feel like a physiological urge. Many people with tics have described that it feels like when you have to sneeze. Tics can range from mild to severe and can be self-injurious and debilitating when they are more severe. Tics regularly change in type, frequency, and severity, and they can be suggestible. So if you're around someone with tics, it can cause the tics it can cause someone to pick up the other person's tics or to tic more. Or if you bring up or talk about someone's tics, it can cause them to tic more. Types of tics: vocal tics. They can be simple vocal tics. Examples of these are sniffing, throat clearing, grunting, hooting, and shouting. Complex vocal tics are words or phrases that may or may not be recognizable, can occur in and out of context. Some specific vocal tics are coprolalia, echolalia, and polylalia.
So types of motor tics. Simple motor tics usually involve just one group of muscles. A common motor tic is eye blinking. I'm going to ask everybody to do an exercise. I'd like you to continually blink your eyes like this while you try to read the rest of the slide. And I'm going to count on my fingers and tell you when to stop, please. Go ahead and stop. From doing that exercise, you can likely tell that it is difficult to read. It's hard to keep your focus. And I have heard this exercise described as frustrating. Eye blinking is one of the most common tics associated with Tourette syndrome.
Other examples of simple motor tics include facial grimacing, jaw movements, head bopping or jerking, shoulder shrugging, neck stretching, and arm jerking. Complex motor tics usually involve multiple muscle groups or combinations of movements. Examples include hopping, twirling, jumping, sticking out the tongue, kissing, pinching, tearing paper or books.
So now I'm going to ask you to do another exercise. This exercise is a staring sensation. I'd like for you to find an object to stare at, open your eyes wide, and stare until you blink, and maybe do it again, perhaps one more time. And now I'll explain why I had you do that staring sensation. I know I, for one, can't keep my eyes open without blinking for very long. Often people that have tics, they can't suppress their tics. And if they do, it is very difficult. When you feel that need to blink and you blink, it provides a relief. That relief is similar to the relief that people feel when they have tics and they express that tic.
So what can make tics worse? Anxiety, transitions and or changes, fatigue, sleepiness. So more than 50% of people with tic disorders also have sleep issues, too many demands at once, illness, or other coexisting conditions like OCD.
So common conditions that co-occur with Tourette syndrome. This is our TAA iceberg. It shows that tics are at the tip of the iceberg, and there are many conditions that fall underneath the iceberg that aren't as readily seen. These statistics were developed by the CDC, and they do reflect children with Tourette syndrome. However, adults with Tourette syndrome have many of these similar co-occurring conditions. As you can see, anxiety is the most common co-occurring condition at 61%, ADHD around 50%, and about 1/3 of people have a diagnosis of OCD. OCD, even without a diagnosis, commonly does co-occur in Tourette syndrome. Often it occurs as obsessive compulsive behaviors.
So here are some self-calming techniques that can help to ease tics: belly breathing, deep muscle relaxation, guided imagery, mindfulness, meditation, and taking a break.
So treatments for Tourette syndrome can include management of tics, which can involve CBIT, which is Comprehensive Behavioral Intervention for Tics. This is an American Academy of Neurology approved first line of treatment for Tourette syndrome and tics. Often you can find this treatment by contacting your neurologist. Occupational therapists, psychologists, social workers, neurologists, psychiatrists can all be CBIT certified. Oftentimes, medication can be used to treat tics, and also people with co-occurring conditions use medication for treatment of ADHD, OCD, and anxiety. Oops. DBS, which is deep brain stimulation, is a rare form of treatment for Tourette syndrome and occurs to treat tics in more severe or extreme cases.
So here are some statistics on the impact of TS on children, adults, and families. And this is from the Tourette Association of America's impact survey, which was completed last year. So 72% of children have experienced physical pain because of their tics. 33% of children have participated in self-harming behaviors. 80% of children felt that tics negatively impacted their school experience, and 70% of children have experienced bullying directly related to them having TS. 87% of adults have experienced physical pain because of their tics. 58% of adults have participated in self-harming behaviors. 87% of adults experience social difficulties related to having tics. 72% of adults have felt discriminated against. 43% of parents reported managing their children's tics caused financial problems for their family. 40% of parents reported their child has at some point disclosed intentions of or thoughts of self-harm. 15% of parents lost their job or aren't able to work as often due to taking care of a child with tics. 28% of families struggle to cover higher costs of services.
So there are many wonderful and brilliant people with Tourette syndrome. And some of these people are famous, such as Tom Howard, an award-winning soccer player, Anthony Irvin, an Olympic gold medalist, Billie Eilish, singer, songwriter, including 7-time Grammy winner. David Bednoff, BBC correspondent, and it has been said that Wolfgang Amadeus Mozart, even though not officially diagnosed, appeared to have symptoms of Tourette syndrome. So at the TAA, we have several resources which you can access by visiting Tourette.org, www.tourette.org. Specifically, if you go to our resource page, you can access all of our resources. We have a guide for children's, a guide for children, a guide for teens, an educator's guide, a patient and family guide. We have an introduction to Tourette syndrome. We have a brochure with more information on CBIT. And I'm sure I am missing some of our wonderful resources. There are more. Please visit our website. You can also access hard copies of these materials if needed by reaching out to support@tourette.org. We offer in-school, in-service presentations on Tourette syndrome, both virtually and in person. Please again, reach out to support@tourette.org and you will be connected with the right people to answer any questions about this program. We have several youth programs for children, teens, and young adults. We also offer workplace presentations. You can visit Tourette.org to view upcoming events such as our national conference, our yearly gala, webinars, and awareness campaign. Support@Tourette.org will provide you with any inquiry information that you need. You will be connected to the correct person.
Thank you all for joining us today for Introduction to Tourette Syndrome.